The Southern African Alcohol Policy Alliance in South Africa says it's baffled by government's chosen strategy relating to the sale of alcohol during the upcoming Easter weekend. The organization says the new COVID-19 measures for the Easter period are an opportunity lost. To find out more, we're joined by Maurice Smithers, the Director at the Southern African Alcohol Policy Alliance in South Africa. A very good morning to you, Maurice. Thanks for joining us. Why do you say this is a lost opportunity?
Thank you. Good morning. Well, you know, if you look back to December, just before the festive season started, there were similar warnings about a second wave and about the fact that the festive season and all the partying and celebrations that would take place might lead to increased infection rates. And we made similar suggestions at the time that stronger steps should be taken to reduce alcohol consumption. That didn't happen, and we went to a situation on the 6th of January, only after a very belated ban on alcohol, complete ban on alcohol. We went to a situation of 21,000 new daily infections and 844 new deaths. Our concern is that we're heading into the Easter season now. There's going to be four or 5 days of public holidays, relaxation. We're going into a holiday period from the 23rd of April to the 6th of May. That includes another 2 public holidays. And we know that that's when people relax. That's when people are likely to drink more alcohol. So we believe that in order to avoid both a rise in infection rates and also to avoid another ban, because we are not supportive of bans for a variety of reasons, we believe that there should have been stronger measures taken to reduce the possibility of alcohol consumption, excessive alcohol consumption. Instead, we have restrictions on off-consumption alcohol, which is not the major problem. On consumption is much more of a problem because of social gatherings, and we have an increase in the number of social gatherings. We really fail to see how that is going to actually help to prevent a rise in cases over this period.
I hear your concerns, and they're based on scientific responses and warnings, as you say. But there's also the flip side. I mean, the other day, the University of Johannesburg held a conversation about how all of these restrictions impeded the rights of South Africans. How do you feel about people who say we have the right to choose for ourselves?
Well, how about the right of people to public health and safety? One of the problems about alcohol is that people who drink excessively, and again, we're not talking about people who drink in a very moderate way. We're talking about the harmful use of alcohol. The people who drink alcohol in a harmful way actually impinge on the rights of other people. People who sell alcohol in unrestricted manner, in all hours of the day and night, disturbing the neighbors, are also imposing on the rights of other people. So, rights are not absolute. They have to be seen in the context of other rights. And we believe that the rights of people to public health and safety outweigh the rights of people to drink excessively. We're not saying people shouldn't be allowed to drink at all. And that's why we say we are opposed ultimately to the use of bans unless they are absolutely necessary as an emergency measure. But we do believe that it is possible to restrict the use of alcohol. And all we were suggesting was that, for example, over the public holidays, that on-consumption outlets close at 6 p.m. That means people can still buy alcohol. All alcohol outlets should have closed at 6 p.m. That means people could still have bought alcohol from off-consumption outlets to drink at home, but you would have avoided people meeting together in social gatherings, because that's unfortunately where the problems happen. Because when people have had 2 or 3 drinks, they forget about wearing masks, they forget about social distancing, and then the possibility of super spreading increases, the possibility of interpersonal violence increases, pressure on the public health system increases, and then we're back to the possibility of a dramatic increase in the number of infections and deaths.
So, Maurice, where is the middle ground where you say you are opposed to bans, but on the other side you feel the president lost an opportunity here? What should he do?
Well, like I said, if you look at what's happened globally, South Africa has been an outlier in the sense that it has imposed bans. But in most other countries in the world, and I'm excluding places like Brazil, where they've been hard hit by the pandemic, but have taken almost no measures with disastrous consequences. But in many other countries where they've been hard hit by the pandemic, the first thing that they've done is to limit social gatherings and to close or severely limit the operating hours of on-consumption outlets. They haven't banned off-consumption. So in other words, in those countries, throughout the pandemic, since March, February last year, people have always been able to buy alcohol, at least to take home. But on-consumption has been restricted because that is where the risk of spreading the virus is greatest. It's a very simple fact. So that's why we are saying that the balance is to restrict on consumption, not ban it altogether at this stage, but restrict it. And if we had chosen, as we believed should have happened, to close on consumption outlets at 6 p.m. on public holidays, that means that people would not have gathered in large numbers, and they would have then reduced the risk of the spreading of the virus. So that, to us, is the balance. Our concern now is that, people are going to be relaxing over this period. They're going to want to party. They can now gather in greater numbers than before, and they can drink till 11 o'clock at night. And some will drink beyond that, because we know that some people ignore the regulations anyway.
When you look at your concerns, what carries more weight? Is it the behavioral side, or is it the scientific side, where there hasn't been any scientific link to alcohol and the possibility of getting affected or infected?
There's a deeper problem that we face in the country. And it's only partially a behavioral issue, because it's very important, and this is where we differ completely with the liquor industry, because the liquor industry calls for what they call responsible drinking. In other words, they're saying if the individual modifies their behavior, then the problem will be solved. What they're ignoring is that individuals live in a society. They live in a social context in which they are influenced by what is going on around them. So nobody in any society in the world makes decisions independent of the environment in which they are living. Now, the challenge we have in South Africa is and this has been recognized by government, we have inadequate alcohol legislation, we have alcohol advertising, we have peer pressure by people in communities which pressurizes people to drink. We have the normalization of alcohol, the glamorization of alcohol, and all of these combined lead to a situation where people actually indulge in dangerous drinking practices. Our objective in the work that we're trying to do is to encourage a situation where we have what we call an alcohol-safe South Africa. That is where people drink alcohol in a safe way, safe for themselves and safe for the people around them. But it's impossible to do that. I mean, one of the bizarre things, even now, about the period of the pandemic, is that there's never been a ban on alcohol advertising during this period. There have been periods in which the industry itself has stopped advertising, logically, because there's no point in advertising your product if people cannot buy it. But even though alcohol has been made available again, but people are encouraged to reduce their consumption because of the pandemic, advertising continues. So people are actually under pressure to drink on the one hand, but to not drink on the other hand. So we need to find a way forward that is going to lead to a situation where we change our culture of drinking completely, where we drink in a safe way, and if we have a pandemic in the future, there'll be no need to have these very, very harsh restrictions, including bans on alcohol, because people will understand the need to be more cautious about the way in which they drink.
Are you engaging or lobbying government or the presidency in terms of these positions that you hold? Because one would imagine that they need assistance in terms of making South Africans aware of the dangers of the wrong use of alcohol.
We try and engage with government all the time. You know, the proposals that we made last week, which we put out in a press release, we sent to the NCCC, to the MAC on health. We sent it to the presidency. We sent it to the Department of Trade and Industry. We sent it to the Department of Health. We've been trying to engage with government through various other channels as well. But, you know, government is not unaware of these issues. We have a new policy on alcohol, which was adopted in 2016 by Cabinet, which recognizes the fact that we need new legislation, which in fact is based on the World Health Organization guidelines for the reduction of alcohol-related harm. And that is basically reducing or limiting advertising, reducing availability of alcohol, and increasing the price of alcohol. All of that is contained in the 2016 alcohol policy. The problem is that we actually have a divided government. We have a divided cabinet. We don't have consistency and one agreed upon strategy by government on how to deal with the issues. So therefore, when legislation is put forward, it gets delayed, it gets opposed within cabinet, within government, by different portfolios who have different interests and see their interests, the interests of their constituency being impacted. A very good example is Fikile Mbalula, who's currently the Minister of Transport, said last year that he believes that alcohol advertising should be banned. But he admitted at the same time that back in 2013, when he was the Minister of Sport, and the Department of Health attempted to introduce a bill called the Control of Marketing of Alcohol Beverages Bill, which would have banned alcohol advertising, as in the same way that tobacco advertising is banned. He then opposed that bill because at the time that he was Minister of Sport, he saw that bill as negatively impacting on the sporting community. Now that he's Minister of Transport, where he sees the impact of the harmful use of alcohol on drinking and driving, he believes advertising should be banned. We can't have an approach by government that operates like that. We have to have consistency. We have to have the political will from the whole of government to follow through on the policy that we have. And if there are going to be consequences, unintended consequences, and we believe there will be, and naturally, for example, increased unemployment or some people having to close down businesses, then there need to be mitigating steps taken to address those problems, but as a complete government project, and in fact as a complete national project. Because as you say, government does need help. It needs help from civil society. It needs help from everyone to actually follow through with this thing and to make the creation of an alcohol-safe South Africa a national project. And the sooner we get there, the better, because it's not going to, the sooner the legislation comes into place, even the better, because the change, the shift in culture is not going to happen overnight.
Yeah.
It's going to take 10, 20 years for us to reach that point at which we can say that we now have an alcohol-safe South Africa.
I agree with you about the difficulty in culture change. People who love alcohol really love alcohol. What sort of challenges are you getting in this regard? I mean, for most of our conversation, we've been talking about the government side, but just in terms of the buy-in from the population, in terms of getting the message of changing the way they use and approach the usage of alcohol?
Well, you know what's been, first of all, it's important to remember that in South Africa, only around 31% of people aged 15 and above actually drink alcohol. People are surprised to hear that, but that is the World Health Organization figures from 2018, and those figures are verified by leading researchers in South Africa. And those figures, in fact, are regularly quoted by the liquor industry themselves, have been quoted over this period. So that's the first thing to remember. However, unfortunately, of those who do drink, about 60% engage in binge drinking, what we call binge drinking. That is where people drink excessively, where they have 3, 4, 5, 6, upwards of 10 drinks in one sitting. And the challenge is, how do you shift that? Now, that is not, it's important also to know that those people are not necessarily people with an addiction problem. They're not necessarily what you might call alcoholics, or they might not have a dependency. What they have is a cultural affinity for drinking in those numbers. And that's the thing that we have to change. It's very easy, actually, for most people to modify their drinking behavior because they're not addicted. And in fact, many people who engage in binge drinking only do so from around Thursday, Friday. The rest of the week, they might barely drink. So it's actually quite easy to change people's behavior, but they won't change their behavior if the context in which they are living doesn't assist them to do so. So until we have a society where there's a broader understanding of the risks associated with drinking alcohol and why it's a risk. I mean, how many people, for example, know that in 2018, again, a report was issued that links alcohol to the development of 8 different kinds of cancer. Do people know what is in alcohol? What is the chemical in alcohol that actually makes them drunk? Do they know what the impact on the body is? These are things that if people understood better, they would realize that there's a need to moderate the way in which they are drinking. But it can happen. We believe it can happen, and it has happened. This is a very good example of Russia. Russia has historically also had a drinking problem where people have been very fond of drinking vodka. But over the past 20 years, the government has managed to reduce alcohol consumption by 43%. And they did that through a combination of measures similar to the ones that have been proposed in our new alcohol policy and some of the suggestions that we and researchers have been making over the past year. So it is possible to do it, but we need to start now. And we believe that because the majority of people in the country don't drink, that government will get the support from the majority of people. Because remember that alcohol, the harmful use of alcohol, affects people materially in a number of ways. It's a risk to their lives because of interpersonal violence, because of people who drink and drive. It affects their lives in terms of their neighborhoods, in terms of noise, in terms of harassment of women by drunken people, in terms of domestic violence and gender-based violence. So we believe that if government were to adopt, and we've seen this over this period, the way in which society has responded, how many communities have said how grateful they were at one point when alcohol was less available, because it actually changed the way in which their neighborhoods worked. It made their neighborhoods quieter, safer, more peaceful, more pleasant to be in. That's where the support's going to come from. And the shift will only happen through effective legislation, as happened with tobacco back in 1999.
Well, thank you so much for presenting that different view for us from all the other people we've spoken to in this regard. Maurice Smithers is a director at the Southern African Alcohol Policy Alliance in South Africa. Thanks for your time this morning.
Thank you very much.
Today